Hi, everyone. Welcome to the virtual road trip. And as everybody is getting on, I see participants rolling in very quickly. Want to wish everybody a happy St. Patrick's Day. And we were just talking amongst ourselves that none of us were wearing green, but we have little green splotches. We all have a green plant or something around us to note the holiday. But most importantly, we're only, 3 days away from the official start of spring. I think that's much more to celebrate, don't you think? So everybody's ready for nice weather and to say goodbye to this past winter for all the challenges we've had. So anyway, we are glad to have you and delighted to be traveling again to Chicago. We've had quite a few Chicago visits on our road trip this year, and that's fine with me. I'm a Chicago native. And Julie Bogus, who is my colleague here, she is the Director of Grants and Consulting Projects, is in Chicago. For those of you who are new to the road trip, my name's Pam Brandon. I'm the president of AGE-u-cate Training Institute. Our home office is in Texas, but again, my roots go back to Chicago. So thus the reason, I guess, we were meant to have lots of Chicago speakers this year. So welcome everyone, and want to welcome Susan Satchel, who is the Director of Business Development for Gentle Home Services in the Chicagoland area. And we are delighted to have you with us, Susan, to share your knowledge and expertise and passion. Susan does, in addition to her work with Gentle Home Services, does a lot in the community. Very, obviously very passionate. She works with the Alzheimer's Association. She is on the board for the Memory Care Coalition of Chicago and also serves on the board for the Home Care Association of America, Illinois chapter. And does a lot of behind the scenes work for them in terms of advocacy and services, consumer education, employee education. So you've just got your foot firmly planted in this space, Susan, and we so appreciate the time that we're going to have today to be able to just share together, have a conversation, certainly invite our participants out there to chat in questions or comments that you have, and then we will address them as we go along or at the end. But we will go ahead and open it up because it looks like our participants now, most are on. And so lots to talk about with the home care. I mean, a lot has gone on, not just in the past years, but the past year that has been significant in, I guess, all of us learning something new. But let's start with just that. Where's home care been? And especially where what have we gone through in the last year from Susan Satchel's perspective?
That's a full question.
It is.
We only
put
have an
about 10
hour.
questions in one, so it's loaded. Absolutely.
Well, the home care industry, especially in Illinois, we've seen a lot of demand for the services as people do want to age in home. And about 12 years ago, Illinois became a licensed state. Not every state has licensure. We're kind of special that way. And it's come to the point where, we need to take a look at these regulations and modernize what home care can provide in the home as healthcare has really shifted this past year. There are probably about 800 licensed agencies in the state of Illinois. And as we see more technology come into healthcare, there's a lot of online services that might be available for a family. But these don't fall under the same guidelines as a licensed agency does. They're not regulated, they're not licensed, they don't follow the same protocols that we do. So, are we going to see that grow in the future? Probably. Are more companies going to get involved in home services? Absolutely. And is licensure going to change? We hope so, because there are things that we feel that could be safely accomplished in the home. And we don't want to operate outside the scope of our practice.
Mhm, mhm. What about this last year and just the drastic pressures of, that COVID put on all providers, but specifically home care?
I think as much as everybody has been prepared with infection control, and we never heard of PPE equipment in the context that we have now with, it was just masks and gloves. Now it's all the gowns, and it's the face shields and the different kinds of masks. No matter how prepared we all were, whether it's home care or other industries, nothing prepared us for this kind of emergency preparedness for equipment, training. How do you use all this equipment? What do I put on first? What do I take off first? What do I take off last? What can be reused? What is more disposable? And then where do you get it? Suppliers were limiting a lot of us based on your historical purchases. Now all of a sudden we've got to quadruple our supply, and nobody could get it.
Yeah. One of the panelists just chatted in to one of our participants to us. Does anybody know if there is a decent push to have government fund the agencies to pay family caregivers who are keeping our loved ones healthy and out of long-term care?
There are a couple of initiatives out there. There is a Senate bill that is looking at offering a 20% credit back to the family for home care. We're hearing the max is going to be between $5,000 and $6,000. There's another one that is in the works, but it hasn't been announced yet, to help those families.
Yeah. We all had a discussion several times in the past week as we were preparing for this, and certainly a concern for all of us in this space is the cost of long-term care, and the fact that so many Americans just do not have the funds, and it comes down to families who are caring for their loved ones at great expense to their financial situation. And the sandwich generation who are caring for both, maybe putting kids through college and also caring for families, and having to secure their own future. So there's certainly going to be more and more pressure on families moving forward with this.
We've talked about this before. I think a lot of the older adults think that Medicare covers home services, and they don't. Medicare is a physician-driven, physician-ordered, federal, state covered service. Medicare pays to do things to you, but not for you. So if you need help with getting dressed or bathing or your meals or medication reminders, these are what they consider custodial tasks, and they're not covered under Medicare.
Yeah. Julie, for all of you, her background is in the long-term care community arena, and certainly you can speak to, I'm sure both of you, the number of families that you've talked to over the years who simply don't understand this, and it's a matter of education. We need to continue to educate people on understanding what is paid for and what is not, so that they don't have the big surprises. And that's just public education, right, Julie?
It's immensely complicated for people to, wade their way through the Medicare benefits and what is paid for, what's not paid for. And now you add a little bit of the complication of some of the HMO plans that start to talk about things like transportation and meals on wheels at home and escorts to doctor's appointments and things like that. that's good, but it is also just immensely complicated for elders and their caregivers to figure out how to plan for their future. How do we access services, and who pays for those services? And we've talked about also the fact, and Susan, you mentioned this, that our system of insurance through Medicare is very reactive. It's going to pay after something happens. And I just have believed for a long time that we need to start shifting our thinking about this insurance program to more of a preventative services to help people age in a healthy way and be able to stay at home, like we know most people want to do that. So I think this is a very important conversation to have.
Yeah. And my background was for many years in family education. And, I can say that we just we all need to be doing more of it, no matter where we are on the spectrum, no matter where we are as stakeholders in this space. We need to give families more education along the way of this, not only prior to them caregiving, just so people really understand what does it mean, so that they don't have these huge surprises.
I think that
And
is such.
how do you change the paradigm shift from, you're in your 30s, you're getting your first house, your car, you're getting your job, you're starting your family. Nobody starts thinking about, oh my gosh, I'm getting old. What am I going to do when I get old and I'm 80? And who's going to take care of me? There are 56 million people in America that are over the age of 65. And by 2050, they project that number to be at 84 million people.
Mm-hmm. Yeah.
And the number of people that are 85 and older, there's going to be 19 million of those 85 or the super agers that are going to be on our earth in 2050. It's huge.
It's
And
huge.
you look at the audience that we have today, 40% of the older adults over 65 are going to need care. They're going to need some help with their activities of daily living. 70% of those are going to need help at some time in their life. And I'm not pulling these statistics out of randomness.
Right.
These were published in the Value of Home Care report by HCOA and the Global Coalition on Aging. So there is data to show where this movement is moving.
Mm-hmm.
And you think 9 out of 10 people want to age at home. So if we have 100 people on our call today, 9 out of 10 of them, 90% are going to want to age in place. And 80% of them think that they're going to be able to age in place in the current residence.
Mm-hmm. I think part of what you said too, Susan, about, you're young, you're in their 30s, your 40s, who really does think about, oh, when I get 80, this is going to happen. But that is the conversation that needs to happen when you're 30 and 40. And unfortunately, I know this is getting sort of big and out there, but to a certain degree, we're an anti-aging society. So we don't really want to think about that until that crisis hits. But I think what is going to need to happen and help change the paradigm with this a little bit is we have to start making this a national issue. Our aging society has to become a national issue. It needs to be, along with the other top issues of our day, it needs to be one of those issues that's being talked about. And so, we're talking about the mindset of people and planning, but we're also talking about who's going to care for all of us when we age. Where are we going to find these caregivers? And I'm just curious about what your thoughts are on that, Susan.
It's already an issue. There is already a shortage in healthcare. There's a shortage of physicians. There's a shortage of nurses. During this pandemic, there is a shortage of caregivers. Maggie Keene referenced that on her recent tour with you guys. It hasn't changed. We thought during this pandemic that we were going to see maybe an influx of people coming from other industries to come into our industry. Retail got hit real hard. The restaurant businesses got hit real hard. Well, they didn't come into our world to be a caregiver. They just didn't, sadly. Um, and then the CNA schools, they were doing, if they were even open, everything was virtual and the class sizes were limited, or, you know, so their enrollment was really hit too. I don't want to talk about immigration. We don't even know where the next wave of these, caregivers are going to come from. We got to breed our own. We've got to make this an attractive field for people to want to be part of. It's a calling when you want to provide that personal care, especially in the home environment. When you're in a nursing home or a hospital, you're going from room to room to room and you do task, task, task. When you're in that home and you walk in and you close that door, it's you and them. And it's not only the tasks, the personal care, the companionship, activities, board games, puzzles, watching TV, conversation, reading, listening to music. But now you got to be that domestic engineer. You've got to do all the meal prep, clean up, grocery shopping, do the laundry, clean the house. Oh, now I got to go do personal care. Oh, now I got to go take a shower. Oh, now I got to go change the dryer to the washer.
The ultimate multitasker.
You have to be the master of multitasking. And then you throw in the family dynamics and the family expectations, and this one wants that and that one that, and who's the boss? That older adult should be driving the bus, making the decisions. But as we know, as people are losing their cognitive ability, and the reason you have care is because they can't live home alone. So that caregiver has to know how to manage all this stuff. And it's hard work. That's why we call it work. And you have to have, I think, a special nature to be able to walk into a home and quickly absorb what's going on and get to task, because you only have a few moments to make that first impression.
Well, I think, one of the challenges with that, Susan, is that it is hard work, but it's also work that's not valued in our society. By way of living wages and benefits and a career ladder, and how do we create this vocation to be something that people want to pursue? And again, I kind of go back to, we don't want to think about it until we ourselves actually, or somebody we love needs care, and then we're like, well, where are we going to get this care? This is a conversation that does need to take place again at the national level. How are we going to grow this workforce?
That's a good question. I know the 1.9 trillion bill did not include the federal minimum wage increase to $15. People are going to have different opinions about that. And I think one of the things that we have to recognize is making sure that our caregivers are paid a living wage. I think a lot of agencies are reporting that they're paying a minimum of $3 over minimum wage. And we have for a long time. And making sure that the caregivers feel valued and appreciated. There's a new movement to have a CNA 2 program so that the CNAs now have another career path. Not everybody wants to go and become a nurse. Mm-hmm. They're comfortable being a CNA, and that's okay. But why not have another level of them, or to have, the certified dementia practitioner credential? That would be another career path for them. Could we charge more? Well, yeah, the families would have to pay a little bit more because we want to pay the caregivers more to give them more of a variety of work environment, add to their skills, keep this industry growing, because it's going to become even more of a demand. And we have to be ready for it.
Didn't you mention in our previous conversation, Susan, too, that many caregivers do not want to work for as many agencies, that they want to be able to scale and work with one or maybe two agencies, so that they really feel that, maybe cohesiveness, but not be spread out. I mean, they're doing it now because they need full-time hours, or even more than full-time hours. But talk a little bit about that and what gentle home services and what you see the other agencies doing to accommodate the
Question. You know,
request.
I think back in the day, you used to see a caregiver at least, maybe apply and work for 4, 5, maybe 6 agencies, because you never knew where your shifts were going to come from. Um, so when COVID hit, everybody was taking a look at, their client mix and their caregiver mix. And right away, we knew we didn't want to have caregivers working in multiple homes. Many of the families themselves said, you know what, I'm working at home anyway, I'm going to take care of mom. So a lot of the families immediately suspended service for their safety and protection. Caregivers felt the same way. And we had to support that, whatever, whether it was a health issue for them or safety issue or just good best practice, we knew we had to put a clamp on how many people were in a home, and we didn't want them to be working in multiple locations. And then making sure that everybody had the PPE equipment.
So let's shift a little bit. I'm trying to look at chat too. So let's talk about the aging in place movement, because it's become, more and more. We're reading about it. We're seeing it. We should have been doing this 20 and 30 years ago, but so we're late in the game, right? But also we've had a lot of advances in technology. We are educating more families, and we need to be doing that more as stakeholders in this space. But talk a little bit about where you see the technology, where you see things going, what agencies are going to be able to do to provide for their clients, and what people can do at home to age in place before they need your assistance when we're going into a community.
Well, there is a movement, the National Aging in Place Council. The website is ageinplace.org. Surprisingly, there are only 15 chapters in the United States. It's growing. We have a very active chapter here in the Chicagoland, and I'm part of that. And I think some of our participants, my friends, are in the organization as well. I think we have about 30 members. We had to be criminally background checked to be part of the chapter. And our whole mission is consumer education. And we've been very fortunate to be invited to speak at different libraries and senior centers, educating the consumer before they have the need, to start to stimulate these conversations and thinking ahead. You don't know what you don't know until you're in a situation, and then you're knee-jerking, gathering information quickly, and sometimes making an emotional decision, not an informed decision. And one of the things that the National Aging in Place Council does is how to age in place. I mean, that's our focus, but we talk about, you're in your home, things that you can do now. We talk about tidying up, purging your home. How many homes have we seen that at quarters? China and dishes and furniture and just stuff. People don't need all this stuff. So start streamlining. Maybe there are some things that you could do in the home to redesign and reconfigure things to maybe help stay in your home for a couple more years. Looking at some managed services. This is your lawn, your snow removal, your heating, your air conditioning, flooding, maintaining your property so that it's healthy, it's livable, sustainable, and pretty much ready to go when it's that time where you do need to transition to another level. That house has been maintained. Or having a care manager come in maybe once a month to just have another set of eyes to check in, see how they're doing, reporting back to maybe remote family. But then if you have to look at making home modifications, there's some easy things that you can do that are very minor to very major. You know, with everybody working at home, people were looking at their homes and converting an extra bedroom into an office or building on an addition. Well, guess what? There was no lumber to be found. Everybody was thinking the same thing. I think it's gotten better, but supplies in the home building industry were in short supply.
Yeah.
But there are easy things that you could do to remedy some things at home. You know, we always look at the safety things, the lighting, those cute little throw rugs, get rid of them. Grab bars, widening the doorways, you know, the bathroom doors. Look at your own house. Does your bathroom door swing in or swing out? If it swings in and you're in your bathroom and you fall in that door, how is anybody going to open the door to get you out? So think about it. If you had a door that swings out, you know, that person falls, you're going to be able to access, it's a safety issue. Looking at a smart home. We have a smartphone, but what about a smart home? You know, using the, I don't want to, you know, I'm not getting product payment from anybody, but there are some really cool devices out there to, you know, manage your front door, your safety, your cameras, the temperature in your room, a water sensor by your sump pump. There's a lot of easy things that people can do to make their home safe that support them being as independent as possible. And then I think one of the biggest professions that are underutilized in the home is those occupational therapists. They can walk in your kitchen and design this, and you drop the sink and raise the dishwasher. Easy things that help an individual maintain some independence and dignity in their home for as long as they choose to live there. It's not that hard. It's just thinking, you know, what can I do different? And maybe having these professionals come in and give you a whole different perspective of things is like, oh, I didn't know that. Oh, I never thought about that. It all makes sense. But you got to take that initiative to explore that.
Yeah, we, one of the comments was, you know, from our participants, you know, we have not had have never really had a society become less so in the last several decades of parents living with their children. I think it's coming back some. You're seeing homes where they're building, you know, living quarters for parents with, you know, and accommodating that. However, that has not been the building design for the last 20, 25, 30 years. We are seeing, you know, I'm in Texas, you don't see many ranch houses. You're in Chicago, you don't see many ranch houses that were built in the last 20, 25 years. You know why? Because builders could make more money by going up and putting more houses on a piece of land. And so, you know, they do have accommodations for that, but, you know, in general, I think, gosh, if builders would look at this now and think, even though we're late in the game, think about building on in the initial design of a home to have a parent's quarters with maybe a room, a kitchenette, you know, they're obviously their own safe bath, so that they could live at home. And certainly, you know, it would be great if those caregivers would have some tax benefits or something that would be an incentive for them, because you know, it is hard work to care for people. And if those things were in place, and maybe we will see those. Maybe that's, you know, there's lots of discussion going on with all of those topics, and I think we're going to see more and more of that, hopefully.
Yeah, I love those multi-generational home concepts.
Yeah.
You know, and there's also a movement, it hasn't caught on here in the Midwest yet, but those small group homes where you have you know, 4 or 5 individuals that share a home together. They all have their private bedrooms and bathrooms, but then they share the common pieces of the house. You know, I'm already looking to see who my girlfriends are going to be to move in my group house.
Yeah, it is, that is, I've read a lot about that, and I think it's something we're gonna see more of coming out now to accommodate that as well. So again, a lot of this goes down to education, educate people on what are their choices, how to look ahead, how to start planning for long-term, your long-term care needs when you're 30, when you can start putting small amounts away. And think about too, having those discussions with mom and dad. What is it that you want? And can we make these decisions before there's a crisis? And that's often, too often, when decisions get made is there's a crisis, and then those decisions are often not made by the parents. It's made by the children.
Well,
So,
Julie,
yeah.
we used to see this all the time when talking with families. They're not thinking ahead, and I think these are difficult conversations for the older adult to welcome, because they're very private and they're very protective of their information, whether it's financial or what their health issues are. I think they camouflage and cover up a lot, because I think they're afraid that, oh my gosh, if they really knew what was going on, they're going to pull me out of my house and put me in a nursing home.
Sure.
And
yes.
they're afraid of that. The first sign is when you've got to take those keys away. That's the first sign of someone losing their independence. And that is so difficult to have that conversation. And you hear families, well, my mom passed the test. I'm like, yeah, but should she really be driving? She might have had 20 minutes of clarity during that driving test. And then, holy cow, on the way home, she forgets how to get home. You keep turning left until one day you forget to turn left. You end up in Iowa.
Well, the mindset of the silent generation elders was, it was very stoic. And, we're independent, we take care of ourselves, and we don't need our children to do X, Y, Z. So yeah, I had my share of families who had no idea where mom and dad's bank accounts were, even how much money they had, those kinds of things. But I think it's interesting to think about, with baby boomers aging now, if our mindsets are going to be a little bit different, more different about those issues, about planning and preparing. I just don't know. I don't know if baby boomers are still, for the most part, in denial about their aging and desperately trying to continue to hold on to their independence and their, whatever. But one of the, I don't know, I think one of the things that is still, an aspect in our society is that we don't embrace aging. We are very youth centric, and our society was built around that. It was built around young people. And, when you look at the age demographics in our society, you see it's the triangle, and the bottom half is all of those young people. Well, that is completely turning the other way around. So we're going to have more old people, fewer younger people, which creates a problem that's really quite profound in terms of Social Security and being able to support some of these social programs. But I come back to my thought, my thinking about a lot of this is, it's got to start with public policy. There has to be public policy that is recognizing our aging society, and we begin to put all of these aspects of aging in place, and what we need as a society to support that has to start at the public policy level.
And that's where we need to start talking to our representatives. There's no reason why you can't start advocating today and start making phone calls. And, it just takes a little bit, and you start to build up that momentum, and start being an advocate for yourself. You have to be. We rely on everybody else to do it for us, and look at some of the dumb decisions they made. We need to have a role in that. It's all of our responsibility.
Yeah. One of the one of the things we had talked about too was coordinated services among providers. And this is a good conversation with you and Julie, because you both are, Julie coming from the long-term care community model and home care, and we've got hospitals, and you talked about this revolving door, Susan, when we had discussions before, where people just continually go, they're going from the hospital and going into either skilled nursing or home care, getting sick again, going back into the hospital. What could be changed? I mean, it seems like we have things started and then they kind of fall apart, these systems.
Well, CMS updated their conditions of participation with that whole discharge planning model. Julie helped me with this. I mean, there was a lot to it, but we know that communication is a huge factor when you're going from A to B to C. The sender has to give all the information to, the next location, and they have to receive it. We had a situation where someone was coming home from the hospital. No one told us that this person was COVID positive. And when the paramedics come into the driveway, we're like, they're throwing equipment at us. This guy's positive, and we had no clue. So breakdown in communication this past year, everybody's working remotely. We hear a family that's struggling with, well, we need the equipment, they need to get this and this and this. I'm like, well, who's your discharge planner? Never talked to one. Well, what do you mean you never talked to one? We don't know what's going on, and I think they don't know what's happening on our end either. Someone comes home, you have a transition plan in place. You've got your home health, you've got your home care, you might have the palliative support, and then you have a family who flies in from California, the B team, and they unravel everything. And in 3 days, it's a disaster. And you call back to the discharge planner to report what happened, because here they think they had a safe discharge and they did everything right, and then everything got unraveled, and now this person is vulnerable. And are they going to ping pong back to that ER in 30 days? Yeah.
Mm-hmm.
Are they going to fall at home again? Yeah.
Mm-hmm. I like what you said yesterday when we were talking, let me, as the home care agency, work with your resident or your patient for 30 days after discharge. Contract me, pay for me, my agency, to provide care in the home, and we will help you prevent that hospital readmission. And from the skilled nursing perspective, I lived through that whole time of the Affordable Care Act, where we were supposed to become a more integrated care delivery system for older people. And it's still very siloed. We are still in our silos. We've not been able to break out of the vertical silos and create them more horizontally, so that there can be a really high level of coordination of care. And just to give you a quick example of what I'm talking about, working in skilled nursing, you might have a resident patient admitted to your community who has a physician that's their general practitioner physician. They go see the doctor, and the doctor says, I do not like the way your congestive heart failure is sounding. I'm going to send you to the emergency room. They go to the ER, they see a doctor in the ER. Then they are admitted to the hospital. They might have a hospitalist assigned. So the GP is not the same doctor that's seeing the patient in the hospital. And then the next day, there's another hospitalist, a different doctor. Then that person's eventually discharged to a skilled nursing facility, and that patient goes under the care of the skilled nursing facility's medical director or attending physician, because the hospitalists don't come to the SNFs. And so you've got this fragmented delivery system, and there hasn't been enough focus or maybe incentive or reason for this creation. And it's happened in some locations throughout the country. I understand there's pockets of evolution with this. So I'm not saying this is across the board, not the case. There's very highly coordinated systems out west, but it hasn't quite sort of moved across the country in a consistent way. And I think our workforce issues could really be benefit greatly by a more coordinated, collaborative effort among all of the providers, of elder people, including home and community-based services. Let's get those Meals on Wheels in right on the first day of discharge, instead of having to wait a week for those services to get put in place. There's just more coordination that needs to take place.
Yeah, that transition planning should start before they even get admitted, especially for a
Yeah.
planned admission or planned surgery. But when you have the emergency admissions or just an admission, that transition planning should start not within 24 hours, the same day, because they're in and out of that hospital in 3 days. And then it's going to take the family. Sometimes they're like, oh my God, what's going on? They're gathering all this information. They're worried about their loved one. And then, oh, by the way, you need home care, and here's a list. And the list is like, 5 pages long. It's out of date. They're not licensed agencies. The phone numbers have been disconnected. The agency's no longer in business, or this one moved. It's our system has been fractured for a long time. And I think this past year has just heightened the awareness just how bad it is.
Mhm.
And it's created an awareness of how bad some infection control practices are and how poorly organizations are staffed. Whether you're for-profit or nonprofit, staffing has been an issue for a long time. But God forbid you bring in an organization that can provide you with a couple nurses or a couple CNAs to manage the floor or a shift. Yeah, it's going to cost some money, but when you can reduce your overhead with wages, you're saving on unemployment and workman's comp. So it becomes an operating expense. So you still want to have that resident to staff ratio to keep people safe. And we know that this past year has just been, we've only seen the bad stories in the news. There have been wonderful things that have happened.
Mhm.
People have gotten good care. They've survived COVID. People have done the best that they can. And I don't want to be, Debbie Downer. There's a lot of bad stuff happened, but there was also a lot of good stuff. And people did the best that they could. They were heroes. I'm getting goosebumps just thinking about them. And some of our staff were, I would put them in
So
that
true.
category too. I think we're all trying to work within the confines of the system. The system needs to be looked at. And I think somebody's been commenting in the chat, we've got to break down these silos. And you talk about the ACOs and the post-acute networks. Home care is not part of that because we aren't covered by Medicare
Right.
or public aid. So we never had a seat at that table to look at their readmission rate. Medicare just published the penalties. We can't afford to just keep losing money or pay people back. So why not invest in a solution? Hello, Mr. CFO of the hospital. Hire me for 30 days to take care of some of your frequent flyers for 30 days. Keep them, help prevent falls, manage their medication, manage their hydration and nutrition. Those are the 4 reasons why people generally end up in the emergency room. So if I can help you for keeping someone safe for 30 days to help reduce your readmission, reduce your penalties, it's a little bit of cost here, but it's a savings, a huge savings at the other end. I think it's just very narrow sighted and people aren't looking at that.
Well, and hopefully, because we've had such unbelievable challenges in this last year, it has brought to the surface the brokenness that we have, the places that we are really have, we knew there were lots of areas of improvement, but it just accentuated those areas. So with any hope, more discussions like this are taking place at higher levels, and amongst ourselves, like you said, can all become much stronger advocates by doing, simple things ourselves or within our organizations to let people know that are the people who can make change at the state and federal levels.
Yeah.
Susan, I'm not gonna, obviously Julie and I are just not gonna let this conversation go until we talk about training and education and how you feel about not only, we know we have a pay issue. That's one huge, we know we have to do better messaging for this whole industry to get people to come to this, to want to come to this industry at no matter what level. But we are very passionate about quality training and education. Tell me what you feel, how you feel about that. I mean, we're bringing maybe not as many people in from other industries that we thought, but we're training a whole lot of people. And in this past year, many of them gotten basic training. I mean, enough to get them on the job. So this is something else that we've said, oh my goodness. And when you told us about the CNA level 2 job level training, I think that's really exciting. It's giving somebody a career path. We are quality of life training. I mean, that's what, we're that step beyond the required training, just to pass the state regs. What's your thought?
Oh, I'm a big advocate of training. I don't think you can ever learn or know enough. There are no two families that are the same. No two situations are the same. You get your basic core training, but almost 4 years ago, the Alzheimer's training bill was passed. That required, I think, 6 additional hours of training on top of IDPH requires us to do a certain amount. Now we add on this other 6 in addition, and then ongoing another 3. What's next? And I think everybody this past year, it was great when you could do things in person. You'd send information in the mail, or you'd have a webinar, or you do a Zoom class. But the real learning comes from when you're having a conversation and you have a group of caregivers that are talking about, well, I have this situation, and then everybody starts brainstorming. Well, I tried this or I tried that. And I think caregivers themselves are starting to become educated consumers as to what kind of agency they want to work for. And I think Maggie talked about that too. I mean, they're looking at job ads a little bit differently. They're also asking questions, or they should be asking more questions about, how are you protecting me? Are you giving me PPE? Are you training me on the safety protocols? We can't do enough in our industry, and it does come at a cost. You have to pay people to be trained, and you offer them some compensation to be part of that, and being creative, since we haven't seen anybody, offering different classes, whether it's mail-in or classes like this, or, to a program with AGE-u-cate. It's thinking out of the box, and people learn in different ways, and trying to tap into that in the different ways that are available.
Yeah. Well, then we could obviously go on and talk a lot more about home care and all the different facets of this. I think that as we move forward, we're going to see more and more technology. We're going to see more advancements. Hopefully we're going to see things change at the federal level that will allow home care to do and be more, because the demand, as you said, is only going to continue to skyrocket. It's not going away. So we have to deal with these issues head on, and so we can all be better for it. So Susan, I just thank you so much. I want to just Julie, did you have anything else that you wanted to share?
I have to jump in on this training conversation
Yeah,
real
yeah,
quick, 30 seconds.
yeah.
You know, working in skilled nursing for so many years, one of the things that was so evident to me is that the training to become a CNA or to be a housekeeper in a nursing community, a nurse, an activity worker, was so very focused on the task of the work. It was, how do you run a good activity? How do you make a bed? How do you map a floor? How, all of the how-to stuff, and nothing about older people. What is it like to be old? What is the aging process? What happens when people age? And it is that part of the education that we have so severely lacked. We have taken people into this industry, whether it is home care or a nursing community, and we have said, check off the box. Okay, you know resident rights, you know you've had your background test, you've had this and that, and now here you go. Good luck. And so we have got to do a more robust job of providing that knowledge about aging to people, to the new workforce.
We do, and that's a great intro to wrapping it up to tell you all about what we're going to be doing next Thursday. So that's the 25th at 1. We are going to be doing a webinar on our Reveal Aging Workforce Training Solutions that we have been developing this last year very enthusiastically. We're going to do some demos. We're going to be talking about what we have developed so far, what we are going to be developing and rolling out this year for the direct care workforce. These are 1-hour micro learning content, easy to deliver, device friendly trainings that are effective, they're impactful, and you know, again, very easy and to start and stop and take as needed. You can go on our website and get our white paper on it. We are going to be giving away some trainings next week. So you are going to get something in your email about the demo on this, so you can learn a little bit more about what Reveal mean, what it stands for, and a little bit about the research behind these programs, why we developed them, and as Julie said, you know, it's going beyond the basic check your off the box training. It's quality of life, quality of care training. It's that extra, it's that CNA level 2 training that, you know, would be, it's just so important because we have so many people that, especially living with dementia. We just completed an in-home dementia basics for in-home caregivers that will be on our website and ready for sale within the next few days. So we're very excited about that. So that's next Thursday. And then I also want to talk just a little bit about next month's road trip, and that's on April 21st. And we will be having Robert Espinoza, who's the Vice President of Policy at PHI. He oversees its national policy, advocacy, research, and public education, support of the direct care workforce, talking about COVID and the vulnerabilities that has researched for older adults and persons with disabilities, racial and gender injustices, and how can we advocate, again, how can we advocate and to make change? So Robert is a great speaker. He is nationally known. He's really, he's going to be a great follow-up to Susan, to this conversation here on talking about, you know, what's going on in the direct care workforce and the 4.6 million home care workers. 4.6 million, and how many do we need in the next 10 years? I've read that somewhere. Double that, I believe it is. Yeah, I believe it's double. So in any event, anything either of you want to add before we conclude the webinar today?
I'd like to ask people to comment in the chat box what their takeaways are today.
It's great. Thanks for reminding me to do that. I sometimes forget. So yes, we would like to hear from you. So go ahead and chat in any questions or comments. We'd love to hear from you, as always.
Pam, I see a couple comments in the chat. One is, has anyone been successful getting a hospital or SNF pay for part of the home care fees to prevent readmissions? So it's kind of like what your comment was about, are there ways to get those home care fees paid to prevent those readmissions?
I'd like to get in the line.
Yeah, I'm not aware of any kind of model like that.
Wouldn't it be great for several case studies in all states to take place with some of these different, like what you had suggested, give us 30 days, let's look at this and see how it works for the patient, number one, but how does it come out financially? I mean, readmissions are extremely expensive to everyone along, every provider, right? Who's involved with that. So I'd love, get some of these case studies, do some of this testing. Maybe it's being done.
Good comments here in the chat. Good. Thank you, everybody. It's nice to see what resonated with you.
And somebody said, we have been successful getting the memory care communities and assisted living facilities to pay for us. I'm not entirely sure what that comment means, but if somebody wants to clarify that, I'd love to know what you're talking about.
I think she's referring to home care. Is she? Maybe? They're coming in fast.
Yeah. Technology is going to have a place. I just hope that these technology companies look at making it affordable.
Mm-hmm.
I like from Brian, my takeaway from today is the need for more inclusive and less fractured continuum of care. Thank you so much for saying that. I think with the hyper awareness of the issues as well as increasing technology holds a brighter future for us all in this field. I think we should look at it that way. With as
There's
much,
a question.
Yeah, which is
Sorry, Pam.
as much as we've had to learn. Hopefully, we're gonna go forward much smarter.
There's also a question, would you ladies be willing to sign a petition for legislation putting a program in place that encourages and makes it simpler for a family caregiver to be paid?
Done that.
Yes.
I believe I have too, but yes.
Yes. Absolutely. Yes. And we also have you can sign up for the demo next Thursday. Everyone on chat, she's making it very easy. Getting the education out there couldn't be, I say this all the time. For those of you who are familiar with Dementia Live or Compassionate Touch or any of our core programs, and even all of our Reveal Aging training, we always include a component for family education. I am passionate about that. If we as stakeholders are not there for our families, we are missing out at so many levels. And, Susan, how much did you talk about families and their involvement and how important it is? It's just critically important. They are part of the care team. Mm-hmm. And they've been left out. They're often still left out, and we need to include them. Even if we have the difficult B team family that comes in, that's going to happen. We need tools to help caregivers and other professionals communicate with them to deal with the real family issues.
And sometimes it's helpful if they hire a care manager to help be that mediator and help and actually be the advocate for the older adult and kind of keep the family dynamics a little bit at bay, keep them involved, but that care manager is going to be that advocate for that older adult. And that's another field that's really growing this past year because families didn't have anybody. They were isolated in their house. Families couldn't visit, they weren't traveling, so they would hire a care manager who at least could do a telecall with them and communicate with the physician what was going on.
Great information, Susan. Great comments from the participants out there. Thank you all for chiming in. And if for some reason we've missed something, we'll try to address that later or get in contact with you. But I thank you for your time so much, Susan. Hope to have you back, and we'll continue the conversation down the road as we continue the virtual road trip. Hope to see all of you next week for the demo, or in April to visit with Robert Espinoza. He's great. So, yep. Thank you all, and enjoy the rest of your day. Be safe, and we'll see you soon. Thank you.
Pam. Thank you, Julie.
Thank you, Susan. Pam.
Thanks.